This episode is a pretty special one. It is Black Philanthropy Month, and I couldn't think of a better conversation to spotlight this than one with two incredible women behind the Black Coalition for Safe Motherhood. That's Dr. Leslie Farrington and Khadija Stegall. Leslie is a retired OBGYN who started this work after seeing firsthand how racism in medicine harms Black birthing people. She created the ACT curriculum, which is a powerful tool that equips families and their supporters to really advocate for care with dignity. And Khadija, who is a wife, mom of four, and a doula, is the brilliant operations manager that worked with me hand in hand to build out their monthly giving program just a few months ago in the Monthly Giving Mastermind. Now, we talk in this episode about how they launched their monthly giving program, my favorite topic, of course, what's shifted since they started, how they're using iDonate to make it easy for supporters to show up consistently. And as a fellow mom, this conversation really hits home. If you care about safe births, health equity, and supporting Black-led organizations doing the work, this one's for you.
You hear the usual, get a doula, make sure your provider is on the same page, but we don't really talk about advocacy much, and we don't really equip Black women on how to have these hard conversations when you are disagreeing with your doctor. How do you navigate that? White coat syndrome is definitely a real thing, and so sometimes we feel disempowered to speak up because we're told to listen to our doctor and that our doctor has our best interests in mind. And so I've always educated mothers in my circle on prepping for the hospital. So many people don't know that you can deny interventions that your doctor suggests. And so advocacy is just so essential.
Okay, I am so giddy to have both of you here since it has been months since we've been back together. And for those that are new to the Black Coalition for Safe Motherhood, Leslie, I'll direct this first question to you. Can you tell us a little bit about the mission and really what inspired it, and especially the creation of the ACTT curriculum?
I'm so happy to be here with you, Dana. So the Black Coalition for Safe Motherhood is dedicated to improving the health and well-being of birthing families. Our ACT curriculum offers the tools and support to more confidently navigate perinatal care. We use the ACT steps as a self-affirming and potentially life-saving reminder to ask questions until you understand the answers. Claim your space. That's your bodily autonomy and your dignity. So physically and mentally, claim your space. Trust your body is the one T, and tell your story is the other T. Now, my inspiration came from learning about medical errors as the third leading cause of death due to preventable infections, medication errors, misdiagnosis. And so it happened because back in 2006, I was a volunteer with an organization in New York called Pulse Center for Patient Safety Education. And it was with working with them that I helped to develop an intervention that community members, patients and families could use to improve both their experiences and their outcomes in medical encounters. So this grew out of the grassroots patient safety movement. And I knew then that patient safety is dependent on optimal communication among all involved, including the patient and the family. So this is important for everyone to know. Everyone who hears this, if you are facing a medical challenge, bring a support person, your advocate, your support person to help improve your understanding and your knowledge and to prevent mistreatment, misdiagnosis, etc. So, and for the Black community, as a Black physician, I knew that this was triply important to understand these principles. And I learned about disparities, inequities in maternal health in 2014. And I realized that the communication between medical professionals and Black consumers of medical care was woefully deficient, often leading to traumatic and even deadly outcomes. Then as I also came to realize that racism in medicine and society was causing so much harm, I wanted to focus my guidance on the power that patients and families have to take charge of their care.
Yeah, it can be often one of the most intimidating circumstances when you're in a doctor's office and think they are just the powers that be, right? And have all the answers. Where following that kind of like templated, that framework you shared can put you in the power seat to make sure that you're confident in receiving the care that you deserve. Khadija, how did you find Black Coalition of Safe Motherhood?
That's a great question. Leslie actually found me. She reached out because I had a course at the time. I was teaching others how to become virtual assistants. And one of my students, I believe, was supposed to do work with Leslie in the organization, but she wasn't able to. And so Leslie reached out to me. And this was actually during a time where I had just had my fourth child and I was taking a break. But I have a huge love and passion for Black maternal health. And so when she reached out to me and she told me everything that she needed help with, I was like, oh, it's not even going to feel like work because it's what I live and I breathe. And so the organization has been such a blessing, and it really truly doesn't feel like work sometimes because just going out and educating mothers and the mission and what we share is so needed. Even when we go out to expos and different conferences, I hear so many people say, I didn't know that this was creative. This is so useful,
Yeah.
because you hear the usual, get a doula, make sure your provider is on the same page, but we don't really talk about advocacy much, and we don't really equip Black women on how to have these hard conversations when you are disagreeing with your doctor. How do you navigate that? White coat syndrome is definitely a real thing. And so sometimes we feel disempowered to speak up because we're told to listen to our doctor and that our doctor has our best interest in mind. And so I've always educated mothers in my circle on prepping for the hospital. So many people don't know that you can deny interventions that your doctor suggests. And so advocacy is just so essential.
Yes. Thank you. Is your donation page leaking donors? According to iDonate, roughly 89% of visitors leave your donation page without giving. That's not a traffic problem. That's a conversion gap. iDonate's new pop-up donation form is built to fix the CVR gap. It's mobile first, moment driven, and appears right when inspiration strikes on blogs, campaign pages, or stories. More donors, same traffic, less friction. iDonate lets you control the strategy, the voice, and the design. To see it in action, you can launch a demo at idonate.com or click the direct link in the show notes. For that, I love how we connected. It is Black Philanthropy Month, and Back Black was in partnership with iDonate and myself to provide the monthly giving mastermind experience to an organization. And you all were the selected winners of that application that you went through for the experience. And the hard work that you were doing takes systems to spread a grassroots movement. It takes support, it takes funding. And what I remember loving, what Floyd from Back Black loved, and what iDonate loved, was that it's such a perfect organization for a grassroots initiative trying to spread, trying to go, creating a movement fueled by monthly supporters that can give at any level. And my goal is always, right, for anyone to feel like a philanthropist and be able to give. Same thing. And everybody should feel empowered to be able to walk into a room and feel like they understand what's being spoken to them medically and to be in power of that. You ended up launching a monthly giving program for the first time at this point, just a few months ago. What was really the spark that made you say, it's time for this? And what's been the biggest shift since launching just a couple months ago? Khadija, I'll toss that one to you.
Yes, absolutely. I think the biggest shift for us was definitely seeing people who decided to give their hard-earned money give testimonies behind why they decided to become a donor. And so our first donor, she is actually a nurse. And she said, I've seen firsthand how important advocacy is. And so I want to be a part of this mission, everything that you all are doing. And so we know, that the work is important, but of course, sometimes you are in the nonprofit space and you're marketing, you're asking for donors. Sometimes you don't always see the results immediately, but it just felt really good to see that people really believed in our mission and people really wanted to support us. So I would say, again, like one of the biggest shifts is just seeing the importance of like the mission and other
The
people
feedback from
knowing the
people.
important, exactly, the
Yeah.
great feedback. And I'll let Leslie share more.
Well, I would say that we knew at that point that we needed to make big changes if we were going to tap into the potential of individual donors instead of
Right.
depending mainly on grant funding.
I think a lot of organizations are going through that right now, for sure.
Right, right. So that's why we committed to going through the process of setting it up.
And the website, everything just like looks so good and something to be so proud of and to go, and it's clean and easy to get the information that people need. And a lot of small teams might be really hesitant to launch a recurring giving program because it's like, oh, it's one more thing that we have to do. For somebody that might be in that mindset right now that you're on the other side of it, it's launched, you're always going to be working on cultivating people and bringing them in. But what would you say to somebody who might be like on that teetering of, should I do it? Should I not? Is it worth it? Leslie, I'll go back to you.
Honestly, it is one more thing on top of all you have on your to-do list. And it does require nurturing if you want
Mm-hmm.
monthly giving to grow. Dana and her team and your group, if you do this with a group, will show the way. So that's the good news. You'll learn ways of accomplishing your goals. And if you don't do it, you're neglecting a funding source and a community of support that you could be building. So
Right.
it is a commitment, but it's a necessary commitment, I would say.
Yeah, absolutely. I mean, obviously, I'll jump on the mountain to talk about it all day, but I think it's integrated into everything. It doesn't have to be end of year appeal or monthly giving. It doesn't have to be event we're doing or monthly giving. It doesn't have to be like, I think sometimes we think about it as or, but it should be integrated as a and included into everything we do to give people the option of how they want to be a part of our mission, how they want to contribute. Just like Khadija, you were saying earlier with that supporter, it was a great way for them to maybe be an entry level donor and they understand that advocacy takes time and that they're willing to be part of that community to make that mission happen over time. Now, switching over to the impact side of things, the work you're doing is incredibly powerful. How did you really work in bringing the mission, and how are you continuing to bring the mission and the story into growing the monthly giving program consistently? Like what messaging, what storytelling, what do you think is really resonating with people?
Well, I would say the team, the I Donate team that built our advocates page on our website did a fantastic job taking my description of how ACT learning and practice can equip families to mitigate discrimination and mistreatment, and how it can save lives by families partnering with their healthcare team. They did a great job of putting that together. They really turned it into a great storytelling page. It's very convincing.
What I want to say about that too is some of what you do might, and this might be for listeners too, you might feel this way. What we do is complicated, it's complex, it can be full of maybe jargon words. And what we really look to do is to how do we communicate it so that it's clear and succinct and it creates what I always say is mind movies. How do we bring somebody into it so that they feel like they're a part of the mission and that it doesn't sound confusing, but clear when you read it, and that you immediately are like, yes, I want to be part of something like that. Khadija, did you want to add something to that?
I think another thing too is the power of storytelling. I remember you all recommended that we do a Mother's Day campaign. And
Yes.
I believe that is how we received our first donor. We sent out a newsletter, a few newsletters, I believe, during Mother's Day. And that's when we received our first donor. But inside of our newsletter, we really just told the why, the story of why we have our organization, what the Advocates is all about, what your donation can do for, the world and for Black families. And I think storytelling and just really just laying out your why can be very powerful for people.
Yes. I remember in I forget if it was the Welcome series where you tell your story because
Yeah,
it's coming from you and like literally showing a photo of you doing one of the trainings. And it's like, oh, I'm going to connect with the person. It's not just a random name on an email. Like this person is also very immersed in the work. And I think we forget
exactly.
that sometimes is like, it's just, oh, another name on an email, but no, connecting the actual story can be extremely beneficial. Not all donation forms are created equal, and not every campaign needs the same kind of giving experience. That's exactly why I had to share what I donate breaks down in this blog, the 4 types of online donation experiences. You can click the link in the show notes to read it through. Now, whether you're running a fast-paced social campaign for, let's say, Giving Tuesday, a storytelling rich landing page, or a major gift appeal, there's the right format to match the moment. Think of it as pairing the right tool with the right emotion. This guide helps you align your donation format with your campaign strategy so you can inspire action, not just clicks. You can head to idonate.com/blog or click the direct link in the show notes to read it now and start creating giving experiences that actually convert. Leslie, you mentioned we're using iDonate as the giving platform. Really excited to get the new iDonate pop-up embedded and up on the site. What's been from before, I think it was just individual Stripe or PayPal forms that were on there. What's been helpful or surprising, or really just talking about the tech overall of consolidating things to help with monthly giving growth and sustaining it?
Well, Khadija can speak more to the tech, but I like the idea that the communication with the monthly donors happens automatically. There's a series of emails that they're getting, which are just amazing. And that's part of the whole thing. It's not just a website or web page. It's got all this, the bells and whistles. So, but Khadija could speak more to that.
Yeah. To explain that real quick, what we did is we were able to integrate iDonate into Flowdesk, the email platform you're using. So as soon as a new monthly donor comes on board, then they receive this automated 4-part email welcome series that we created in Flowdesk. And Khadija helped to draft and to write.
I
Yes.
think I was the first person that joined, I think.
Yeah. Yeah. Well, if you run a nonprofit, it's just easier to just streamline things and get everything on one platform. Sometimes that is possible, sometimes not, but it's just much easier that we have everything in one platform. And inside of iDonate, you can even click inside your dashboard to see everyone that is giving. And so it simplifies things definitely a lot versus keeping track of, oh, who donated in every.org, which is a platform we used before iDonate, who donated here, there,
Right.
look in all of these different places. And so it's creating more work. And what you were saying earlier about people maybe taken aback by launching their giving program because it requires you to do more work. Well, you just have to streamline it and work smarter. You're already going to send out a newsletter, so just add a little section about giving. You're already going to post on social media, so just add one more post about giving. And so I love how things have just been streamlined a lot more now, and it definitely makes things easier on the back end.
Yes, yes. How can we make better use of our time, since bandwidth is always something that is difficult with all of our different schedules? So, for anyone that's listening that really cares about health, equity, maternal care, safe births, what is one thing, and I'll let each of you answer this, that they wish they knew about how to truly support this work? Leslie, I'll go to you first.
Well, to ensure that we can continue to offer ACT workshops and trainings to birthing individuals and their partners and supporters, we need consistent support from those who care about helping families.
Am I hearing a monthly giving ask there, Leslie?
Okay, so we need
Don't be
monthly
shy about
donors
it.
to ensure continuous support of our programs.
No more shyness around it. This goes for all of the listeners too. Be bold on that ask. Their monthly giving program is the Advocates. You get to join the Advocates and you get incredible emails from this team. They just launched a new, Leslie was just telling me about ACT ambassadors going out and spreading the word about what they're doing in trainings. Like this could, as a mom and as somebody who also struggled with needing to advocate for myself in a situation where I was improperly told something by a medical professional, it's so important to be able to have this and to know, to have the team behind you like you guys are. Khadija, what about for you?
Yes, we need supporters. So we need monthly donors. And also just sharing our workshops. We offer free monthly workshops to our community. And it's always great to have people on and to have people share because we want to get these workshops out to people that need it the most. So they're free and it's always a safe space and great conversation. And people always just walk away with a lot of great information and they feel empowered. Another thing is if you become a monthly donor, we do give you access to our ACT Facilitator training program, which will actually empower and equip you on how to advocate for yourself. And so even if you are not pregnant, you will just learn advocacy skills that you can use for yourself to deal with your own healthy journey.
Or friends, family.
Yeah, you can help a friend, family, maybe another mom that you know. You'll definitely learn another skill. So that's one of the benefits of becoming an advocate with us as well.
Love it. Amazing. Where can they sign up for those? For the trainings and to be a part of the Advocates?
Yes, so everything is on our website, blackcoalitionforsafemotherhood.org. And you'll see a button to donate. And as soon as you sign up for the Advocates, you receive a series of emails and we'll get you enrolled in our ACT Facilitator training. Also, you can follow our social media channels on our website, through our website as well.
Amazing. Where can they connect? Where can listeners, the peers are on here listening and they're like, oh, I'd really like to ask her about this or this. Leslie, where can people find you?
Well, they can reach out to me, Leslie, at BCFSM.org.
Perfect. And Khadija, where's the best place to reach out to you?
They can reach out to info@blackcoalitionforsafemotherhood.org.
Awesome. Beautiful. Thank you both so much for being here today, for working on your program. It does take so much time to nurture and grow, but then it's powerful to see those responses like Khadija, you were talking about. Thank you both for being here and for everything that you do. Thank you so much for tuning into today's episode of Missions to Movements. If you enjoyed our conversation and found it helpful, I would love for you to take a moment to leave a review wherever you're listening. Your feedback helps us reach more change makers like you and continue bringing impactful stories and strategies to the show. Don't forget to hit that subscribe button too, so you'll never miss an episode. And until next time, keep turning your mission into a movement. Thank you so much for listening to today's episode. I hope it was helpful and valuable to you. And I wanted to let you know my signature program, the Monthly Giving Mastermind, applications are open for the 6th round that will start in July. If you are someone that wants to increase your monthly recurring donations, but just have not had the time, the bandwidth, the people around you to do it, this is the opportunity. You can head to positiveequation.com/mastermind to learn all the details. I have a video that breaks it down. I showcase what we're going over every month. It essentially takes the 5-step framework that I teach in my book and puts it into practice that we do for you. So head to positiveequation.com/mastermind to learn more and apply.